Welcome to the Golden Hour, the podcast community where moms and moms-to-be hear stories from other mothers and top experts in the pregnancy and postpartum care field. You can visit goldenhour.fm for more information, resources, and all other episodes. You can also find us at goldenhour.fm on Instagram for comments and questions. Welcome to today's episode of The Golden Hour. I am your host, Dr. O, and today I am joined by Dr. Nazaneen Homaifar. She is a board-certified OB-GYN, originally from North Carolina, now practicing the DC area. She completed her medical degree at Duke University and her OB-GYN residency at University of California, San Francisco, UCSF, where we first met. We go way back. Such a beautiful memory. And she served faculty at UCSF for about 4 years before moving back to the East. She is now the System Division Head of Routine Obstetrics at Inova Health System. Nazaneen also holds her MBA from Harvard. So yes, she's equally fluent in pelvic exams as she is in pivot tables. What are pivot tables, by the way?
You know what? I still don't know. Just because I did a course in finance doesn't mean I can do pivot tables, but I did really enjoy my MBA.
Yeah. Okay. That makes me feel better because when I was reading your blurb, I was like, pivot tables, something I have to learn. Anyway, she's passionate about health equity, digital innovation, women's health, and empowering patients through better education. And when she's not catching babies, operating or leading system-wide initiatives, she's home with her husband, her twin daughters, and her brand new baby boy, Atlas, our first baby cameo on the show. So welcome, Nazaneen and baby boy Atlas. I'm so excited.
Thank you. I'm excited to be here, and I've loved what you've done on your platform. I think it's fantastic.
Thank you, Naz. And it's crazy. Your formal name in the intro is Nazaneen, but I know you as Naz, so I'm going to refer to you as Naz throughout this because this is just how it is. And it's crazy because we go way back. So you were in medical school at Duke at the same time my sister was, and I still remember when you did your sub-I. I think it was at the General, right?
Yes,
when you did your sub-I, you did your sub-I. Go ahead.
No, go ahead. I just didn't think I was going to get in. After I did this, I was like, there's no way I'm going to get into this place.
No. And everyone loved you. And within the next hour, all the audience will understand why so many of us love you. You're one of the most charismatic people I know, but also you're brilliant and you're such a great patient advocate. But I still remember I was a teeny little bitty med student. I was already looking up to you, like thinking that you were this amazing sub-I, and fast forward, we went to residency together, and now you continue to be an OB that I look up to.
Thank you.
Because you have done something that I've always been inspired to do, and I'm hopefully doing now with this podcast, which is, supporting our patients, advocating for those communities, but in so many different diverse ways, right? There's so many different ways to advocate for change, to push the needle and to innovate. And so you've always been in that space, whether it was from learning how to pivot tables in your MBA or just your inherent skill and natural interest. So I'm excited to have this next hour to catch up with you, but
absolutely
also to brag about you because you're an inspiration, girl. You're an inspiration.
Thank you. It helps when you are surrounded by wonderful people, inspiring people. I've just loved the vibes you've had whenever we've worked together. And I'm really excited to see the number of topics you've discussed and how important they are and making it more accessible to people. Because I don't think we have enough providers out there. It's wonderful that social media has allowed more voices, more diversity in patient experiences. But I think it's also important to make sure as physicians, we're meeting our patients where they need to be met and allowing them access to information that will hopefully empower them, make them feel good about their experience. Especially in obstetrics, there's so much unknown, especially when it's your first time. And to be able to understand how to ask questions, how to make it clear what's important to you is really important. And I think I think you've been able to start that with your podcast.
Yeah, it's like you read my mind. No, I mean, there's so many reasons why I started the podcast. There's so many things that inspired me, but one of the reasons is that oftentimes, and I'm sure you experience it time and time again, where a patient very innocently will say, "Well, I read on Google and I saw on TikTok," and I make this joke that my arch nemesis are Dr. Google and Nurse TikTok because there are a lot of voices out there, and a lot of these voices are well intentioned, but how do patients figure out how to kind of weed through what is factual and what is not, what is vetted and what is not? And so my goal of the podcast of many is to sprinkle my voice amongst the many and hopefully create a platform where patients can get accurate information that helps them feel empowered, helps them go back to their appointments with the right questions, helps them process things that they've experienced or think through things that they have yet to experience.
Yeah,
So thanks for seeing that, girl. Thanks for seeing that.
absolutely.
And I'm so grateful to have you join me in this experience. And as I already alluded to, you and I go way back, and I met you by the time you already started your OB-GYN process, right? Your journey into
Yeah.
obstetrics because you already were applying for residency at that point. What made you want to be an OB, right? We all have our story. Why did you want to be an OB-GYN?
Yeah, I think so. I decided on OB-GYN while I was actually in business school. I had
Mm,
finished my second year of med school, and at Duke, our third year was for a year of research or to pursue a
yep.
degree. This little guy has opinions on that. But I ended on my OB-GYN rotation, and then I went straight to business school. So I remember I loved all of my rotations. I loved
Yeah.
medicine. I loved psych. I loved pediatrics. I loved surgery. I and I had this moment of realization probably while I was sitting in accounting or finance being like, how is this relevant to my life?
Yeah. Yeah.
Where I realized OB-GYN afforded me an ability to kind of touch on all of the fields that I loved. We
Mm-hmm.
have continuity with our patients. We can start from
Yeah.
adolescence and go all the way to, I have patients in their 90s. We have
Yeah.
medicine. We treat chronic diseases. We have longevity with our patients. We get to operate. We get to use our hands. We get to be in a high stress
Yeah.
environment. So like I liked the trauma surgeon and how
Mm-hmm.
they had to act quickly on their feet. And we get that all the time, especially on labor and delivery. There's a lot of psychology in what we do. I
Mm-hmm.
mean, I think every day in clinic, at least two or three patients are crying.
Yeah.
Not necessarily sad tears, but just
Yeah.
tears of, I haven't been able to discuss this with anyone. And
Mhm.
I had some personal experiences myself where, I thought, okay, if you're talking about diabetes or high blood pressure with someone,
Yeah.
there's no stigma to it. But if
Yeah.
there's questions about intimacy, about contraception, about so many things that our obstetrics and gynecology worlds touch
Mhm.
upon,
Mhm.
people can feel a lot of shame. They can feel
Yeah.
discomfort. They can feel embarrassment. And it
Yeah.
was really important to me to be able to help navigate people through those kinds of conversations and experiences without judgment,
Mhm.
with an openness and willingness to help them understand.
Yeah.
I think Dr. O, let me pass this little guy off.
Okay. Sounds good.
He's a little
Bye,
bit more
Atlas.
vocal. Let me
No,
bye.
he's vibing. Bye,
Bye,
Atlas. See you,
Dr. O.
buddy.
So yeah, I think it was a variety of all those factors that drew me into OB-GYN. And I'm so glad I did. I think I wish
Yeah.
sometimes I had thought about the impact of 24-hour calls on the rest of my life, but uh,
Yes.
I
Yeah.
truly wouldn't
You're
have
still
it
doing those
any other.
24s, girl? You're still doing
You're
those
not?
24s? Good for you.
Are you not?
Well, you're like, wait, how is that? No, we technically do. So when we're on call at night,
Like
we are in our
12.
clinic. Yeah. So
Yeah.
basically it's a 12, but it's attached to clinic. So yes, it's like
I mean,
it's more than 24 hours. It's forever hours. But
yeah.
no, you're right. But being 24 hours in the hospital does feel
No,
different to me.
I do those on weekends, but like I
Yeah.
do 12s during the week, but it's still like
Yeah. Yeah.
takes a
It's a
lot out of
lot.
you. But I
Yeah.
truly feel so privileged to have the conversations that I do
Mm-hmm.
with my patients, to have a window into their life that I know
Hmm.
is such a unique relationship.
Yeah.
And I think in this time of, especially in today's political climate where there's so
Yeah.
much fear, uh, yeah,
Yeah. We come from a place of both power, right? And that we have a lot of knowledge, but it's true privilege what we do with that knowledge and creating a space where patients feel heard and seen and safe. Like my favorite clinic day is exactly what you described, where I might see someone to talk about contraception because my office is right by Berkeley campus. So I get my fair share of UC Berkeley college students. And then that same day, I'm like fitting someone with a pessary and talking about menopausal health and
yeah,
everything in between. Like I love the diversity of what we get to do, the richness of our ability to support our patients and their families in whichever way that they need, but also recognizing that
absolutely.
there's true vulnerability in those circumstances. Like that same person who got fitted for pessary might have had symptoms of prolapse for years before she felt like, okay, I'm going to say something. Like
Right.
this has been bothering me, and I feel some degree of shame about my body, but it's time for me to speak up, right? And so it's such a privilege that you and I get to work in that space to make people feel like they have the courage to speak up. And I hope that the conversation that we have today helps fuel that for someone who's listening too.
I
So
hope
it's
so
so
too.
fun for me to hear your story because yes, like I said, by the time I met you, you were decided, you were determined. Like
Yeah.
I am going to match at UCS. Like who are the attendings that you know? Who should I chum it up with? And so I met a very fierce and focused, determined Nazaneen, and you have not left your path since. But now I want to make this a little bit more personal, right? That
Hmm.
um, I am an OB who has yet to start her family, and that's we could do a whole episode about my own personal decisions and timing. But for you, what was it like for you and Stephen when you were like, okay, we are ready to start our family? And knowing I know that you did this while we were residents, which is wild. So for people who are
Hmm.
listening who don't understand residency, we just talked about like doing 24-hour hospital shifts, which is tough. But residency was like over 100-hour work weeks because when we were residents is before they actually, followed the rules and limited our work hours. So we were working our butts off. And you were
Yeah.
like, and yeah, it's time to start a family. Like, what was that process for
Well,
you?
like, no, totally. And everyone has their own way of thinking through it. I think because residency was so hard, I
Mhm.
knew that we weren't going to start until, um, I, you know, when I would be, I was hoping that if I were to get pregnant, I would deliver closer to graduation or
Yeah.
during the summer in between graduating and starting my position. But it's hard because our schedules wouldn't align and you're exhausted and you're not in the
So
mood.
exhausted.
I tell my
So
patients,
exhausted.
like, as much as, the media shows us how romantic this process is supposed to be, like, there's nothing sexy about timed intercourse.
Nothing. It's the anti-sexy. It is a vacuum in space that removes
Yeah.
all the fun.
It's
It's just
yet another chore,
yeah.
yet another
Yeah.
to do. And then when it's not working, it's even harder. So it
Yeah.
did take us some time with the girls.
Yeah.
And I think, and I kept being like, oh, maybe on this vacation, like when we're in this, we're in Vietnam on Halong Bay, like maybe it'll work this time.
Yeah.
No, it didn't.
Yeah.
And
No, because it's real life. It's real life.
yeah.
Yeah.
And we did get a little help with the girls. We were, I was looking at starting IVF and I ended up um, taking a medication to help with ovulation. I didn't mention to Stephen when I took it. He knew I was taking it, but I didn't mention
Yeah.
that there was like a risk of twins with it because I truly did not think it was going to work.
Yeah.
I had already set that appointment up at UCSF Fertility REI for that summer,
Yeah.
but it did work. And we ended up
Mm.
with twins. And one of my
Yeah.
dear friends and colleagues was the one who diagnosed it.
Oh, man.
And the rest
What
is
was your
history.
what was your reaction? I mean, I know we've both been in rooms where we've like done the ultrasound, like, oh, there's two babies in, right? But what was your personal reaction again as someone who is an OB who we know is so much, sometimes too much.
Yeah. Well, so first of all, I will say, as an OB, I had access to an ultrasound sooner than most people do.
Yes.
I
Yeah.
acknowledge that.
Yes.
So I was 4 weeks,
Wow.
and Dr. Greenwald did the ultrasound, and I noticed 2 sacs on the screen. And I told her, I was like, "Why are there 2 sacs?" And she said, "I don't know. Why are there 2 sacs?"
This is
And it was
amazing.
just complete shock. I think I
Yeah.
was laughing because I was so shocked and also
Yeah.
so happy.
Yeah.
I think now I know that I do want to disclaim, like with twins, we know that there's a 50% chance of preterm labor. There's an increased risk of gestational diabetes
Yeah.
and hypertensive disorders, right? But I
Yeah.
was happy that there was 2 sacs. So my OB brain
Yeah.
was like, I was already triaging
Yes.
myself, and my 2 sacs is better than 1 sac. So it's better
Mhm.
out, slightly
Yeah.
better outcomes. And
Yeah.
we had always wanted 3. We had
Aw.
always dreamed of a family of 3, and quite frankly, I mean, we had waited a few years after marriage. I was in my mid-30s, and
Yeah.
I see the pressure of people wanting a certain family size and having to do it back to back to back, and
Mhm.
I thought, "This is gonna be really hard. I mean, we'll do it if we need to, but this will be hard." So then when I saw 2 sacs, I was like, "This is amazing. If this works out, this is amazing."
Yeah.
Um
Yeah.
and I think Stephen was away, and we were
Uh-huh.
about to go to ACOG. So
Yeah.
Dr. Greenwald knew. And then because I was so happy, there was a wonderful janitor in ZSFG who I
Yeah.
told
Yeah.
he found he was number 2.
So
And
he found
then
out before Steven.
and then
That's
number
great.
3 was, Holly. Do you remember the wonderful midwife,
Yeah.
Holly? I told
Yes.
her, and then I think I told Steven.
Okay. Did you purposely want to tell him in person, like he was away on
Yeah,
business, so
I
you wanted
wanted
to tell him
to
you want that
exactly.
reaction?
I wanted
Yeah.
and I wasn't gonna see him for a few days, so
Yeah.
I ended and I couldn't contain myself, so I ended up telling him on the phone, knowing
Yeah.
that I was gonna see him shortly thereafter.
Yeah. Yeah.
But yeah,
But
it was a
still,
really
my
magical
God.
experience, and
Yeah.
so different from our experience with Atlas, and we can talk
Yeah.
about that, but
We'll talk about it. Yeah.
it was really, and I was lucky, like it was a all things considered, uncomplicated pregnancy. We had a scare
Mm.
at some point, and
Mm.
for me, it was really eye-opening to be a patient receiving
Yeah.
inconclusive news. And by
Yeah.
what I mean by that, one of the girls, there was an ultrasound finding, and ultrasound is, it's the best we have. We
Mhm.
There was a potential concern for something. I was
Yeah.
told that if this were to persist, she might need major surgery when she's born,
Mm.
and she might be
Yeah.
fine. I was
Yeah.
like,
Gosh,
"Look."
that's wow, that's a hard gray area to be in.
Yeah, and I
Yeah.
know, and I had phenomenal counseling. I had a wonderful team, but it
Yeah.
made me realize the impact of hearing something like that as a
Yeah.
patient and
Yeah.
needing to just give it time to tell. Meanwhile, you have a 15-minute or maybe an hour-long appointment with the provider. They give you this news, and yet you're home for 2 to 3 weeks stewing
Yeah.
on that information, trying to make sure you keep an open mind that this can still go in many different ways.
Yeah.
That was, I think, really, I'm grateful for that experience because I think it really helped me as a provider to hopefully help patients navigate when they're in a similar situation.
Totally.
And understanding that, like, this information is something in a point in time.
Mhm.
And it's so hard, especially for I'm a type A personality. I know a lot of my
Same.
patients are, where we need to understand, we need the results, we want the input to match the output. And
Mhm.
this is one of those experiences in life where you very quickly understand that the inputs don't always match the output,
Yeah.
and
Yeah.
you just have to give it time.
Yeah, totally. No, I think about the fact that most of us who go into the healthcare field tend to be relatively more empathic people, right? We are nurturers, we're healers, we care, we have, our ways of showing compassion, but oftentimes it's when you experience something yourself that it unlocks something, right? Because we're all still
Yeah.
human. I still say that I'm a human who has the honor to humbly care for other humans, which means I still am learning how to show up and be the best clinician for my patients. And it's really eye-opening when your personal experiences influence that. I'm glad that your scare turned out to just be a scare, but it's important to take those moments and pause. There's a lot of reasons why I'm doing the podcast, right? I already alluded to I want to be a voice amongst the many voices that hopefully are helping give patients vetted information. But I also want to learn, right? I love these conversations because I myself reflect on these conversations and I bring it back to my patients. And I know that if there are other clinicians listening too, it's like that just that
Mhm.
gentle pause of saying, okay, we oftentimes give news often so many times in a pressure box, right? My OB appointments are 10 minutes. That's wild.
Yeah.
That's not enough time, right?
Yeah.
It's 10 minutes, and I'm giving news in 10 minutes that I know someone is going to be thinking about and replaying again and again for hours until the next ultrasound, the next lab result comes back. And so, how can we take 10 minutes and meet our patients where they need to?
Yeah.
I created a podcast because I was like, everyone deserves more than 10 minutes. I want to talk longer, but we all can't create podcasts. So what
Yeah.
can we do? When you think about that moment for you, and of course you have your amazing career since then, but what were your takeaways? What do you do when you have your 15 or so minutes with a patient? How do you create space for them when you're giving them news?
I think one thing there are a few things that I realized. One, and we learned this in residency too, what someone's understanding of the situation based on your explanation, no matter how good we think we're doing, can be very different. And what people hear, I think there's a stat out there that says, I'm going to pause for a second because there's an airplane and I don't know. Can you hear that?
I can hear, yeah, but
Okay.
they'll be able to edit it out, but we can
Oh,
pause.
nice. Okay. I
Yeah,
didn't realize that.
yeah.
Um, I think I read a stat somewhere that patients retain about 30% of what you tell them in a
Mhm.
patient visit. So what I
Yeah,
think I impressed upon someone could be very different than compared to like what they're taking away.
yeah.
And so what I try and do is start with, let's say for a prenatal visit, there was an ultrasound and I say, I saw the results of your ultrasound. And I know that we're going to discuss it today, but let's start with what was your understanding of the explanation
Mhm.
that they gave you?
Mhm.
Because it's
Mhm.
helpful for me to know. And then
Yeah.
once they say that, and once we discuss it, I said, okay, let me talk about what questions do you have?
Mhm.
Let's go through that. And then trying to the best of my ability, again, I don't think I do this all the time, but I strive to, is just recap at the end of the visit what we said the next steps were.
Mhm.
Um,
Yeah.
and I think that I find that very helpful when I'm in an inpatient setting. It's very different. Pulling a stool up and sitting eye level
Mhm.
with the patient, making them feel like they have my undivided attention, even though I carry a phone that's like going off every 5 minutes.
Yeah.
And then again, I think it's really important. What questions do you have? Encouraging them from the start, sometimes saying, is there anyone else you wanted to add on to the conversation? Did you want to FaceTime someone in for
Yeah.
extra ears?
Yeah.
And then encouraging them make a list of questions and especially when there's very complex findings.
Mhm.
Let's figure out who the right person is to answer these questions for you. Because
Yeah.
again, I think in obstetrics specifically, it can be really hard for a patient to understand how to navigate it.
Yeah.
When someone
Yeah.
is admitted to the hospital, let's say for second or third trimester bleeding, depending on the hospital environment you're in, you'll be, you'll have a bedside nurse that's changing every 12 hours. You'll have an OB-GYN who might be changing every 12 to 24 hours. There usually will be a maternal fetal medicine specialist. If you're in a facility with residents, there'll be a resident team, and that
Yeah.
can include 2 to 3 people. There's a neonatologist. Some places will have a neonatology NP or nurse come to the bedside. And so I think it's really overwhelming to understand what everyone's role is and
Yeah.
and what to expect of them. So one of the things I like to do in those scenarios especially when like as the OB-GYN, I don't know how much I have to offer since there's so many specialists involved, but it's
Yeah.
let's take a step back and understand what everyone's role is here.
Mm.
Let me help break
Yeah.
that down for you so you can
Yeah.
understand what you can ask of and how we work together.
Yeah.
Because I think so many times people don't understand
Hmm.
how the system works. And at my confirm visits, at my confirmation of pregnancy visits,
Yeah.
I try and spend 5 minutes just explaining what to expect when you get your prenatal care here. How
Yeah.
many physicians are there? We work with APPs. This is where you go for your ultrasound. This is how
Yeah.
you have to call yourself to get things done.
Yeah.
You know, so much
Yeah.
of it is helping people understand how to operate and navigate the system.
Yeah, yeah, it's so well said. And of course, for you and I who have spent majority of our young adult now adulthood in the healthcare system, right, as trainees and now as clinicians, we know it. So sometimes it's just
Right.
like in my mind, I'm like, it's not that complicated. But when I'm on the other side, either trying to navigate it as a patient, I've helped we all have aging parents, which means we all have our opportunities to help our aging parents through the healthcare system. You always recognize how much more complex it is, and that
Yeah.
ability that we have to kind of pause and set the scene, if you will, of naming the different players, of naming the steps. Because for a lot of our patients, in at least obstetrics, they they are for the most part, fortunately, pretty healthy, which means they only
Yeah.
really access the healthcare system for annual routine appointments. And suddenly they're going to have way more appointments, way more ultrasounds, and be hospitalized, right? Like
Right.
we go to the hospital for our jobs. For you, you've also birthed a couple babies, but we primarily go there to do our jobs. And for a lot of our patients, it's their very first time ever actually being hospitalized. Goodness, the fear, the anxiety of that, the unknowns of like,
Absolutely.
who are these people? So it seems so simple, but I love that you create that space just to like pause and explain.
I remember at the end of my med school, we had like a few courses that were designed for to impart on us a little bit of that business savvy. I mean, we need to do so much more, but I remember the question was asked, how does the patient show up in that room when you're assigned by a chief resident or by the attending physician to go see a patient and get their history? How did the patient end up in that room?
Mm,
And I had this moment. I had already gotten my MBA and
yeah.
it clicked to me. We had done an entire semester on operations. And yet,
Mm,
at no point when I was rotating before I did my business degree did I ever question, how did this patient end up in this room?
yeah.
Do you know how many steps it took? Did they come through the ED? Did they come through the clinic? Did they, was it a direct admit? Was this unplanned, planned? What were the different access points? And so
Hmm.
to help, it was a huge moment of realization for me that, yeah, this patient is just magically showing up in a room for me to go ask their social history and their
Yeah.
subjective and everything. But
Yeah.
they've had a journey just to land here. And they've
Totally.
probably told their story at least 3 or 4 times.
Hmm.
They might not understand why they're here. I mean, how many times have you seen a patient of someone else who's shown up for another induction spot who didn't understand why they were being induced?
Yeah. Oh, yeah.
Right?
Totally. Yeah. There's like, I don't know. I'm just here. And what's an induction? We don't even know what induction is. Okay, let's start
Yeah.
from like
Right.
ground zero. We're gonna work our way from here. No, totally. And I think it's really important for all of us who have the honor of working in this space just to recognize that the journey that brings our patients to where they are when we're meeting them. And that's what helps us meet them where they are, right? It's being curious,
Absolutely.
asking questions of curiosity and being open. But this is you. You're putting on your doctor hat, but you're still in my mind in this podcast, you are Nazaneen, birthers of babies. And I want to
Yes.
talk more about, so we learned about the pleasant surprise of seeing those two twin sacks.
Mhm.
Fast forward, it sounds like you said, besides that ultrasound finding scare, overall pretty good twin pregnancy, although I know those are hard. What was your birth like for you? Was the plan with the
It was
team for you to be
beautiful.
induced?
Both,
Yeah, what
well,
was it?
I had both of the girls were breech, which means they were head up, butt
Yeah.
down. And the twin A was flipped to breech in the last month. So if she had stayed head down, I was going to try and labor and
Yeah.
do a extraction of twin B, so deliver
Yeah.
B breech if needed, but she flipped, so the decision was made for me. In that
Yeah.
scenario,
Yeah.
the C-section is recommended. So again, I was very lucky. I was delivering at the hospital where I worked. I had a magical experience with, I mean, I knew everyone in the room. Um, and Dr. Greenwald was there as
Oh,
well. And it was just, we had we had a date based on their gestational age. Um, you know me, I
yeah.
got my hair done the day
Of
before,
course. You've
got my
I've heard
nails done.
you look fabulous, girl. You look fabulous.
I
It's their birthday, but it's like your birthday.
I didn't do all this hard work to not have good
Yeah.
photos for that day. And
Yes.
also,
Amen.
this, hopefully your audience knows this too. A scheduled C-section so different from an
Yes.
unscheduled one. So
Yes.
you
Of
can make
course.
these plans. And
Yeah.
so we went in, and this was pre-pandemic
Mhm.
when you could have like 4 or 5 visitors in the PACU or in the
Yeah.
recovery area. So one, I had this wonderful team in the operating room. And I had told Stephen, my husband, I had said, like, there will be a lot of people because each twin gets their own team. And I know some people can feel a little overwhelmed by that, but he loved it because he thought, I don't have to worry about anything. There's
Yeah,
so
yeah.
many people here looking out
Yeah.
for Naz and the kids
Yeah.
that, like, I can
Aw.
just enjoy it. And
Yeah.
I still remember, I started after I got the antibiotics, I felt a little nauseous. And
Mhm.
one of my favorite nurses, Molly Killian, like I heard her voice. She said, look up at the lights, take some deep breaths, that feeling
Mm.
will pass. And I say that to my patients all the time now.
Aw,
And
yeah.
so, and then I was talking to Stephen, and I was telling him, and at this point, this is the layer they're on, and this is what they're doing. And
Narrating everything.
yes, but then Dr. Aleshi, who was
Y
my fantastic anesthesiologist, he was like, they're about to deliver. You're like 5 steps behind. They're already at the delivery part.
Yeah. Yeah. Oh my god,
Um,
that's amazing.
and, and when, and when they were born, I was just shocked. Like, I
Mm.
was over I kept I just had this reaction. I was like, "These are my babies, like,
Aw.
they're real, they're out,
Yeah.
and
Aw.
again, I was laughing because I couldn't it was so surreal to
Yeah.
see them and to have felt them moving and kicking and interacting with each other, and then to have them out for the first 3 hours. I was terrified I was never gonna be able to tell them apart, but they look so different. It's
They
just
are very
I had
they're
to
their
get
own
very
little
used to
beings.
them.
Yeah,
Yeah.
yeah.
Um,
Aw.
and then I remember I was being rolled back to my recovery room, and my mom was there, and my sister and her fiance, maybe even boyfriend at the time, I forget now. But they were all there for the party, to
Yeah.
greet these little girls. My dad was at
Aw.
a conference and was flying back, but we had a I was really lucky. It was a
Yeah.
absolutely incredible experience.
Yeah, the pure joy, I can feel it. I can feel it not only because 'cause you're a great storyteller, but just because there was so much love in that room, and there
Yeah.
is some I always want to acknowledge the privilege, right? There's the privilege of knowing everyone who was going to be a part of your team. And there is something about like the planned C-section, right? I've seen
Yeah.
a lot of my patients show up glammed up for the planned C-sections too, because it's their day. And I'm very selfish. I don't get to do C-sections for all of my patients because the ones that happen in labor, you never know
Yeah.
if you're on call. But the planned C-sections, like I'm there too with you. And it means so
Yeah.
much to be a part of that team and have patients
Absolutely.
feel that security of like, that's a known person who's caring for me. But you had that added
Totally.
benefit of knowing the anesthesiologist, and the nurses. Like you knew
Yeah,
everyone in that
my
room.
OB-GYNs, and I just on the
Yeah.
birthdays, I like to send a text to at least the surgeons and tell them
Yeah.
thank you. Like, this is I know this is something we get to do every day, but,
Yeah.
to the
Yeah.
gratitude I feel as the patient for
Yeah.
helping me in that moment.
Yeah, no, that's so beautiful. And then yeah, walking to you're right, it's different now. We now can only have like one person in the recovery room,
Yeah.
which is a bummer, but we get why. But like walking to the
Yeah.
recovery room, and I know your family because I've met them various occasions throughout residency of just like the love and the joy in that room that you got to walk into. So I love that experience for you. How was postpartum? Right? Like I we have had the
Yeah.
honors of caring for so many different patients at this point and recognizing that postpartum is a dynamic shift physically, mentally, and emotionally,
Yeah.
right? It's transformative. This concept of matrescence, right? Where it's the biggest
Absolutely.
physiologic hormonal shift we've had since adolescence. And you're doing this with two babies. Oh, and you happen to have this remarkable career as an OB-GYN. And so I have a story of quote unquote how hard it could be, but everyone's heart is different. Was your postpartum, was that a challenging period for you? What was it like being a mom of twins?
Oh, so the thing is, you just have to do it, right? Like, and especially
Yeah.
with twins, like everyone, I would hear people be like, I don't know how you do it. I don't think I don't know how you guys do it. I'm like, well, I don't have a choice. I have to do it.
Yeah,
And I
yeah.
think you don't, and it was our first, so we didn't know. You don't know what you don't know.
Mhm.
It was hard. It was really hard, but I don't think I fully appreciated that until later. I tell my
Yeah.
own patients that I found that my breastfeeding journey was like much harder than recovery from the C-section.
Mm.
I
Yeah.
there were two, and I was triple feeding for a while. So I was doing pumping, nursing, then formula feeding. And I had told myself that I wasn't going to do SNS. And I don't know what they call it now, but it's where you take the little tube and you feed it
Yeah.
up to your nipple and you try and get the baby to latch. And you have to like hang the little bottle on a hat or somewhere on the side. And I had said, having seen it when as a med student, like rotating with the lactation consultant, I had said, if it ever gets to that point where we need to do SNS, I will accept that I
Mhm.
have my limitations and be more open to formula. And we were formula feeding from the beginning because I wasn't
Yeah.
making enough. But I was like, that's not, I'm not willing to go that step. In my sound
Yeah.
mind and body, I said that. And
Yeah. Oh.
there I was taking 28 pills of fenugreek every day, like whatever it took to get that supply up, which, like,
Yeah.
sleep would have been helpful too. But by the time you did the whole routine, you had an hour to start it again. And I
Yeah.
was lucky. My mom was with me the first 3 months. My father was
Yeah.
getting up with me in the middle of the night to
Aw.
like help me with the girls, and everyone was on a shift, everyone
Yeah.
helped, but it
Yeah.
was hard. And
Yeah.
just like and then as you go through postpartum, for me, it was really hard, like when my hair loss started,
Mhm.
and I was just pulling out chunks of my hair. I mean,
Yeah.
again, we are rational beings. I can sit there being like, I know I'm healthy, I know I'm this and that, but it was really hard for me to
Yeah.
with the physical changes to my body. I loved
Yeah.
being pregnant. I felt so confident. I felt so like I loved it. I felt
Yeah.
comfortable.
Yeah.
I really embraced it. And postpartum was just hard. It was hard
Mm.
not to let my confidence be affected by not just my physical appearance, but
Yeah.
that lack of sleep. I was a new attending. So when I did go back to work, I was lucky. I got 4 months off. But when I did go back to work, I was navigating what it meant like to be a new attending and a new mother. And so it took me a while, but I realized my postpartum depression and anxiety really hit around it started around like the 8-month mark. So I had
Mm.
been back at work
Mm.
for 3 to 4 months.
Yeah.
But I remember it was like my birthday when I went in and sought help and met with one of
Yeah.
the wonderful psychiatrists at UCSF
Yeah.
to start talking about what was going on. And it
Yeah.
just, or maybe I started a little bit sooner, and like that 1 month that my birthday was when I started SSRIs.
Yeah.
But it was hard because I remember feeling like I know I should be enjoying this. I have
Mhm.
healthy children. They're so much, seeing them interact was really fun. I have a wonderful supportive partner who also took like 4 to 5 months off and was taking care of the kids. But I felt so empty, and I felt so just like, I remember exactly where I was when we were walking around our neighborhood. And I have this weird thing with percentages that I like to do, but I was like, I'm 6% happy right now. Like, and I know it should be more, but I can't enjoy this.
Yeah. Yeah.
And so I was really thankful that some therapy and SSRIs helped me.
Mm-hmm.
But it was really, for me, another turning point for, again, as a provider, how I talk about this time frame, how I recognize it. Later on, I would go on to join this wonderful startup. It started out being called June Motherhood and has now since changed to Seven Starling. And it started out as a different platform and pivoted, but now it's a digital health platform, and it's covering women's mental health from like preconception, infertility, all the way to postpartum. And it's really helped me channel that experience into something where we can inform solutions for patients, where we can get them into therapy more quickly. And there's an individual and a group component to it. And I just think in my work with them, it's limited, but I learned so much from the experience, and hopefully I'm able to give in a meaningful way. But it has made me so much more cognizant of talking about mental health, being more proactive, asking at that confirmation visit or the prenatal visits, do you have any history of any mood disorders? Because let's talk about it. You are going to be at higher risk of developing a perinatal mood and anxiety disorder. Let's get you ready before you're in a place of desperation.
Yes.
To be able to address it. It was really, I mean, I think of myself as someone who's able to adapt, someone who likes to be in control of situations, and I had never quite experienced something like it. So that this time around with Atlas, I was hyper aware of the potential.
Yeah.
And I think a lot more proactive about checking in on my mood. I'm 6 months postpartum now, talking to Stephen
Okay,
about,
girl, you look amazing. Go ahead, girl. Go
girl,
ahead.
it's a good thing that we can stay
Nah,
above.
I can see it. I know, but go ahead. In all seriousness, please go ahead.
But yeah, just being a lot more aware of it and being proactive. I signed up for a Seven Starling therapist.
Yeah.
And our first few meetings, I was like, I don't really have anything, like, I'm okay, but I'm just waiting to not be okay. But it's good that I have this in place. And thankfully, knock on wood, I have felt okay. But I think it's because I'm aware of what that feeling was. I can name
100%.
it sooner. And so many times I have patients, especially the second or third time around, being like, yeah, I probably had some postpartum anxiety and depression, but I just
100%.
didn't recognize it, because you don't
Yeah.
know.
Yeah. Yeah.
And then I've been able to, well, and I also think having one is so much easier than having two.
That and that.
I was like, oh my God, like, this is so much easier.
This is a breeze. Oh, wow. No, but
Truly.
that too. One of my best friends in the world, her first pregnancy was twins, and then her second was a singleton, and she's just like, all of you guys out there complaining with your singleton pregnancy. I mean, no, we all know that everything is hard, but it's very different. The one is very, very different.
Yeah.
So I'd like to take a moment to tell you this is my passion project based on years of experience as an OB-GYN doctor. I aim to empower moms and moms-to-be and those in the pregnancy and postpartum care space. If you appreciate what I do, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, suggestions, or questions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. No, Naz, first and foremost, thank you for your candor, right? Thank you for sharing your mental health experiences because it's so real. It is so
Yeah.
real. You and I both know as clinicians how common postpartum anxiety, depression are, and even remarking there's this misconception oftentimes about postpartum. People associate with really the first,
6
6 weeks,
weeks. Yes.
6 weeks, but that's just an
You're
insurance
just getting
coverage that,
started. Yeah,
yeah,
you're
yeah,
just
that's
getting started then.
not real. And I think that's one of, again, many of the reasons for this podcast really was born out of my frustration with our postpartum care, right? I still
Yeah.
remember this patient who I was a great, just like you, I was a great doctor, right? We had a really great relationship. And I remember she saw me maybe a year or two postpartum for her PAP. And she's just like, by the way, Dr. Nseo, you dropped the ball. I was like, what? And we had the type of relationship. She called me out. She's like, yeah, postpartum. It was really hard. And like, where were you guys? I'm like, you know what? You're right. Like, because I am in
Yeah.
Vega healthcare system that only allows me to do 2 postpartum visits up until 6 weeks,
Yeah.
unless someone I've identified already with postpartum depression, anxiety, who I'm already adding them on for video visits then after. Like,
Yeah.
most of my patients go out of my radar unless they really need
Totally.
me until I see them. And when they've come out the other side. And the idea of this podcast is because we can do so much better. I
Yeah.
want us to have the conversations to push the needle, um, and expect our healthcare system to pick up and fill those gaps in postpartum care. And I
Yeah.
do think that both things can be true. You can love your children, but also feel guilt and fatigue and anger
Oh,
and
yeah.
resentment, right? And I think that goes back to that theme of matrescence, and acknowledging that matrescence is this convoluted mix of emotions that we're allowed to have, and
Yeah.
speaking to it. Because I do think that how we were trained, and you and I both trained at excellent places, and how we are meant to practice in the confines of our healthcare system force us sometimes to like box postpartum into this package. But like when I hear
Right.
your story, I think about, yeah, wasn't until 6, 8 months postpartum that you were really hit with your deepest wave of postpartum anxiety, depression, such that it halted you in your footsteps on a walk, right? And
Right.
I'm like, oh my God, how many of my moms who are out there who I like, who are no longer directly in my care, who might be going through this right now? And
Yeah.
how do we speak to it so that people know when to reach out?
And I completely agree. And again, this is something I strive to do. I'm sure I forget to say it sometimes, and like the stress that is like a busy clinic day, but reminding patients, it looks like your screen looked good today, but I want you to
Yeah.
keep in mind perinatal mood and anxiety disorders can affect people up to 1 year postpartum. And I think that's a big,
Mhm.
they're like, oh, really? I think that's a
Mhm.
big point. And then one thing I've changed in the past 2 years, I definitely didn't do this, and I'm almost 8 years out from residency,
Yeah.
which is
Yeah.
to me like a reminder that I'm constantly learning and evolving as a provider.
Yeah.
I've started recommending patients to come in at the 4 to 6 month postpartum, like 4 months after I see them for their
Mhm.
postpartum visit, for a well woman check or preventative
Yeah.
care visit. And I say, let's
Yeah.
schedule your preventative care visit within 4 to 6 months. That gives us a time to check in and at least make
Yeah.
sure you're still doing okay. I
Yeah.
need an excuse to see you. So like
Yeah. I'm gonna miss you. Yeah.
yeah. And so
Yeah.
let's plan it around this time so that we don't have to wait a whole year to make sure
Yeah.
you did okay.
Yeah.
And
I
I have
really like
found
that.
that that has helped as well. I learned that from another doctor who in Texas who were on an advisory board for Seven Starling, and she mentioned
Yeah.
that, and I thought, oh, I really like that. I think that's a
Yeah.
great way to not lose touch and make people, we go through prenatal. By the way, our guidelines for how often we see patients are based on recommendations from the 50s. I remind people like they're not
Exactly.
evidence based, and we're seeing
Yeah.
people with such frequency. And then all of a sudden they're postpartum, and we're like,
Drop off.
great. Oh, only if you've had a vaginal delivery, only if you had a C section do we recommend a 2 week check in. Otherwise, we'll see you at 6 weeks, and 40 to 50% of you won't make that visit. Many of
Mhm.
you will lose your insurance coverage. And we expect after such a high stress kind of event that you're going to be fine with just one visit.
Yeah.
We know it's inadequate. I have started telling patients too, we cannot rely just on our current healthcare system to fill those gaps.
100%.
This is where I think as providers, understanding what else is out there, how else our
Hmm.
patients can be supported, knowing that some people I ask about who their employer is, check to see if you have benefits through Maven or
Hmm.
other services to help you with offer you additional support. I
Yeah.
think if a provider can call those additional benefits out, it's also more likely for the patient to understand how to utilize those services and
Yeah.
how we're all working together um,
Yeah.
to address their needs.
Yeah, agreed. I think about how fortunate I am, quote unquote, that in our system, everyone gets two appointments. Like at some point, I think it was like California changed something. So now everyone gets
Got
like a
it.
2 week postpartum and a 6 week postpartum. And that's a luxury, meaning that there's still 20-minute appointments, which is still not
Yeah.
sufficient time. And as you said, there are plenty of times where I look and any OB or any doc loves a little no-show, right? We love a little gap in our clinic every once in a while. When I look and see who the no-show is,
Yes.
if it's like an annual where I'm like, you actually weren't due for your PAP, great, you're going to reschedule when you can. But when
Yeah.
it's a postpartum, I'm like, oh my God, she probably was so overwhelmed, forgot about this appointment. And I'll ask my MA to reach out to her and try to get her rescheduled. But you're right, there's some who just can't show up. They're just too overwhelmed, or the ones who have to go back to work, right? Like we
Yep.
haven't even talked about parental leave in our country, but
Right.
like the 6 to 8 weeks, 6 weeks if it's a vaginal delivery, 8 weeks if it's a C-section, you are so fortunate that you had 4 months. And again,
Yeah.
you and I both know that we're amongst a group of people who are relatively privileged to be able to take that. But I still
Right.
remember seeing
Right.
a mom who scored high on her Edinburgh depression survey, and we were talking about mood and we were talking about support. And I was like, okay, well, I want to extend your disability. I think we need more time. I think we need to get you in with a therapist. She's like, oh, no, no. My partner and I decided I have to go back to work. Like financially, I can't be on disability. I'm going back next week. I was
Yeah.
like, okay. She's like, and I overheard her joking. It was her own way of probably coping, be like, yeah, I'll just cry at work. Like I overheard her saying that to the staff. And I was like, no, 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 right? Like you and I
I mean,
both, and
it's
yeah,
yeah.
go
Oh,
ahead.
sorry. No, no, no. It's sad. And sometimes you laugh cry, right?
Yeah.
Like you're like, I
Yes.
mean, the fact that this is what this person has to say to help them
Yeah.
and yet how shitty. Like
So
how is
shitty.
it that we are and we'll have another conversation another day. The fact that we are so far behind other countries
So
when
far
it comes to
behind.
parental leave. The fact that we designate a primary versus a secondary caregiver, and that there's a bias in most cis couples, where the woman is meant to be the primary caregiver. Like,
Yeah.
give me a break. And
Yeah.
when are we going to recognize that if you did have two parents involved in the process of procreation, that they should both be involved and sorry, I got so excited I like spit
Yeah.
in what I'm
No,
talking, but like
we're
they should
spitting
both be
everywhere.
involved
Yeah.
in the care. I mean, when it came to when I was talking about my benefits for this pregnancy, I
Mhm.
remember hearing that if I were to have a successful vaginal delivery after a C-section, I would be covered for 6 weeks. But if I had a repeat section, I would be 8 weeks. And I said, do you recognize the misaligned incentives here? So
It's
you're telling,
crazy.
like you are telling me that if I were to have a vaginal delivery after a C-section, the recovery should not be. I take issue with that too. Like the fact
Yeah.
that we distinguish between a C-section and a vaginal delivery. I
Yeah.
agree that a C-section is an abdominal surgery, but the
Yeah.
fact that we relegate vaginal deliveries to 6 weeks for recovery, that's bullshit to me.
Yeah. I
And I
agree.
want to know who to talk to.
I know.
I
No,
want
what you and I are going to figure it out. I mean, we've already alluded to many reasons why I'm doing the podcast, but it really was to take my frustration with our broken, fractured, sometimes feeling inadequate healthcare system and turn it into passion and purpose, right? So the fact that you and
yeah.
I get to like vent and like
Yeah.
spit on our screens about how infuriated we are about this is I'm so happy to have that outlet, and I hope that these conversations are part of many, because when I think about, there are many ways that postpartum care needs to change, right? We alluded to like 1 versus 2 visits ending at 6 weeks when it's clearly long beyond that, incorporating mental health in a big way. But it's
Yeah.
also parental leave, right? That my husband is Turkish and spent most of his adult life in Europe, I know Stephen is from the UK, if I remember correctly.
Yeah.
But there's so many different ways that different countries do parental leave and postpartum care. And so hearing from our friends who had babies in Finland and raised kids,
Yeah.
or babies in Germany raised kids in Finland, those countries are just, it's beautiful what they're
Yeah,
doing. And what does that say about
absolutely.
how they view and respect birthers, primary in quote unquote primary caregivers, whether it's a person who actually birthed the baby or both parents, right? Both
Yeah,
parents getting adequate leave, and then and families, what it means to actually rear a family in our country and then be able to go back to work when you're ready to contribute to
right.
the greater good society, right? That I think being able to advocate for 3-4 months postpartum is a true gift. I definitely know friends in tech who can get longer than that, but
Yeah,
then it's those who don't have nearly as much privilege, who are forced back so much sooner unfairly. And you're
yeah,
right, vaginal versus C-section, 6 versus 8 weeks, neither of them are adequate, but both recoveries are just as physical, right? We definitely have
yeah,
cared for patients who've had a normal vaginal delivery, but have,
right.
a sequelae from that vaginal delivery.
Absolutely.
Girl, if you know, you're the one with the MBA, if you
And
know the people that we can
you
talk
know, I
to
do
change
love
leave and
there is Reshma Sajani, who was the
mm,
CEO of Girls Who Code. She has, I love her Instagram profile because she's a major advocate of this. Chamber of Mothers, I think, is
yeah,
an organization that's working on it. And I feel like I have so many soapboxes. There's only so many issues I can work on at a time. We're
yeah,
all
yes,
limited, right?
yeah.
I'm thankful for people like her out there who are fighting the fight. But if anyone ever needs OB-GYN testimony, sign
Yeah.
us both up
Yeah, we
because
got you. We're fired up over here. No, totally. I mean, it's conversations like this that have inspired me to create the podcast. I want the patients who are in it to know that there are people like you and me and many OBs and midwives that we're representing who feel the same way,
yeah,
who want change. I want this conversation to like tickle the ear of someone who has more power and ability than us and will help promote that change. There's an internal optimist in me that believes that change is coming, right? It will happen eventually, because I know there's a lot of acute things happening right now as we record this that has diverted the priorities of our nation, but we
yeah,
just have to keep talking about these things so it doesn't we don't lose sight of
absolutely.
how important this is.
I agree.
um Anyways, this is great. And yes, I will, you and I will keep talking about these
Yes.
same topics. But now I want to fast forward to your pregnancy with now Atlas. Did you guys know at the beginning of that pregnancy, did he already have a name? I love this name, by the way.
Um,
Was he ready
it's
Atlas from conception?
he when we decided. Yes, my mom doesn't remember, but she's the one who suggested the name to my sister.
Oh
And I
yeah.
remember I thought if we're lucky to be able to get pregnant through this process, because it was a
Yeah.
journey, I love
Yeah.
that name. So yes, we did know, but we didn't. We had our girls make a list of names that they would want. Michael
Uh-huh.
Jackson was on there. I was like, sorry, girls, we can't do that.
Yeah, yeah, that name won't fly anymore.
And they go to a French school, so there are a few French names on there, like Jean
Oh,
Pierre.
yeah.
Martin Luther King Jr. also made the list.
All right, girls, I see you. They are
And
great.
I would suggest, I was like, what do you think of Atlas? And they're like, no, we don't like it. I was like, well, you don't know, but that's the
Whoops.
name it's going to be.
Yeah. Yeah. What
But yeah,
what
we
what
knew.
happened when you told them like, "Hey, and this is your baby brother. We've named him Atlas." Was it like, "All right, fine.
They
We
were
gave you one
thrilled.
options."
They
Yeah.
were thrilled.
Yeah.
It's a handful of a name, but they were just so like awestruck to meet him that
Yeah.
they
Yeah.
forgot that they had ever
What is
said
his many
anything.
names? What's his full name?
Girl. Okay. So
Let's do it.
Stephen being English and having two middle names himself, wanted two middle names. And we wanted to honor the girls have middle names that reflect his maternal and paternal grandmother. So they have
Oh.
Iranian first names and English middle names. Atlas, there is a word in Farsi. It's not an Iranian name per se, but we have
Yeah.
the word in Farsi.
Yeah, yeah.
And so I knew that that was already going to be a little bit of a stretch, that it's not completely like Persian.
Yeah.
Um, his it's Atlas Peter Archibald Hartley.
I like that. So many names. So I just see him wearing a
Ar-
vest and a bow tie.
I mean,
Archibald. Uh,
it was maternal great grandfather who has quite a story to his name. And
yeah, yeah,
so I love it.
yeah,
I'm like, can my son be more English? Like, where
yeah,
my Iranian father, when he heard the name, was like, where's the Iranian part?
yeah, yeah, yeah. I know Archibald kind of cancels it all out. It's just like it could have been the most Iranian first name, but then you just drop the like Archibald like little bomb in there, and just like, whoop, never mind, it's all gone.
I know.
That's amazing, though. That's
Yeah.
amazing. I still love that we got to start the show with his little cameo. But okay, fast forward to your conception, your pregnancy with I almost called him Archibald, Atlas. I'm like, no, no, get back there. It's Atlas, Atlas. So at this point, you had your prior planned C-section.
Yeah.
Did you go into your pregnancy with Atlas thinking I want to be back this time, or I heard about my coverage and I'd rather get the 8 weeks? Maybe I'm just going to do an elective repeat C-section. What was going on in your mind?
So I had always wanted to try for a vaginal delivery if I could. And it had taken us about 2 years, and we ended up pursuing IVF, and we're
Yeah,
really lucky that it worked the first time.
yeah,
So that, I think I ended up shifting my mindset a little bit, just being
hmm,
like, because it took us a while, it got to the point where I thought, I will be happy no matter what.
hmm,
It took us so much time, and I'm just so grateful we can get to this point. And
yeah.
and so I was trying for a vaginal delivery, but all of his ultrasounds, he was measuring greater than the 99th percentile on one of his
I've also
ultrasounds.
seen him and I'm like, yeah, he's a chunker, but in the best way. I'm not body shaming him. I
I'm
love him for all his faults.
like, I am petite. I'm
You
five
are.
feet.
Yes.
And I remember on one of his ultrasounds, probably like the 28-week one, the tech pointed out his body rolls, his abdominal body rolls. I was like, now that's just rude. I don't need to laughing, of course. But I
Yeah.
was like,
Yeah.
come on, buddy, help us out. And I, again, am so lucky to work in an environment where I have so many wonderful colleagues. And I was 40 years old when I conceived him. And so uh, I know everyone knows me as the person who really tries to push for vaginal deliveries when it's appropriate. And I could tell that people were gently concerned that he was consistently greater than the 97 to 99th
Gently
percentile.
concerned. Oh, so well phrased. Keep going.
And I didn't have any gestational diabetes. And so I think all of my colleagues didn't want me to push it. And
Mhm.
I appreciate that. I had colleagues who are my colleagues, but not even in my practice, just calling and just being like, please just don't be a cowboy about it. I really, truly, I'm like, I was touched that people cared.
Mhm.
And so in my mind, I thought, if I were to go into labor, I'd like to try. I'd
Mhm.
like to see what happens because, as I tell my patients, babies will usually declare themselves.
Yeah.
If it's not happening, it's not happening. And you kind of
Yeah.
know maybe this baby was too big. I didn't want to end up in a situation where we had a shoulder dystocia, which we know is an obstetric emergency. And I know a lot of
Yeah.
times it's not detectable, but you know, the babe, the kid's abdominal circumference was about the same ratio as his head circumference. So that was a little bit reassuring, but
Yeah.
the abdominal circumference was always a little bit bigger than the head circumference. So
Yeah.
I I had resorted to, if I can go into, and because I'm advanced maternal age, the recommendation is delivery by 40 weeks.
Mhm.
Initially, I thought maybe I'll push that a little bit. And then, I was like, I don't want to this is tough.
Yeah.
I'm uncomfortable.
Yeah.
I don't know that I want to go past 40. So
Yeah.
I chose a date for my repeat C-section with one of my colleagues.
Mhm.
And I'm so actually happy that Stephen asked me. I was going to do 10-8 when
Hmm.
he was 39 and 2, because that's the day my colleague was on call.
Yeah.
And we know that when you're picking for advanced maternal age, it's anywhere between, when you do a repeat C-section, it's
Yeah.
usually around 39 weeks. So I was like,
Yeah.
39 and 2, that's not a big deal. 10-8.
Yeah.
And then I
Yeah.
remember I called to tell Stephen, okay, we're going to schedule for 10-8. And he's like, can we do 10-10? That's such a cool birthday. And I was like,
Okay.
you're not the one who's pregnant here.
I'm
This
sorry.
shit is
Yeah.
hard.
Yeah.
So,
Yeah.
but it is a cool birthday. It's
Yeah.
a really cool birthday. So whatever, let me check with my colleague, see if she's available, see if we can do 10-10. So I pushed it back to when I was 39 weeks and 4 days.
Okay. Yeah.
7:30 in the morning. I wanted to be the
Yeah.
first. I didn't want to have
Yeah.
to
Let's just
be
get done.
NPO for more than 8 hours.
That's
Um,
rude. Yeah.
and so we scheduled it for 39 and 4. And I was like, if it happens before then, I'll try. And if it doesn't, I know, because if I was closed, if my cervix was completely closed and having to go through an induction where we're limited in what we can use,
Yeah.
I thought I'm just going to go with the C-section because he's measuring greater than 99th percentile. I've never done this before. We'll just do that. And then the night before I was due to go to the hospital. So my C-section was scheduled for 7:30. I was meant to be in pre-op like at 5:30 a.m., 6 a.m.
Yeah.
I was getting ready. I wanted to like
Yeah.
shower. I
Glam.
wanted to
Glam.
glam. Yep, I'm
Uh-huh.
glamming.
Yeah.
I'm glamming. And I feel a little something. And I'm like, did my water just break? And I was like, no. And I always remind my patients it's usually not as dramatic as
Yeah.
what you see in the movies. So I was glamming and I thought, let me just take a shower. And then when I come out, I'll check, I'll put a pad on and see if I'm actually like if I ruptured my membranes. So I
Yeah.
take a shower, I come out, I'm blow drying my hair, and I'm feeling occasional gushes of fluid. I'm like, I think my water broke. But
Uh-huh.
but I was so prepared for this C-section
Yeah.
and I still hadn't done my nails. I decided to do press on nails because I was like, I don't want to use nail polish.
Yeah.
So then I go in his nursery and I'm like doing my nails as I'm feeling
Gosh,
this
I
fluid.
love you. Yeah.
And
You're amazing.
I call my colleague who was going to do the C-section and I was like, Eva, I think my water broke, but I don't know. I don't know, Eva. I'm just going to wait it out at home. I'll see you tomorrow at 5:30. And she was like, "Are you sure?" She's like, "I want you to go to the hospital." I was like, "I'm okay. I'm not feeling anything.
Yeah,
I
yeah.
think I think I'm just going to wait until the hospital tomorrow." Like I knew my
Yeah.
team, I knew
Yeah.
everyone who was going to be there.
It's gonna be great.
And then I got off the phone. She's like, no, like, call me back. Think about it. Call me back. And then I call two of my closest friends who are OB-GYNs on the
Yeah.
West Coast,
Yes.
Dr. Greenwald and
Yeah.
Dr. Langasecra. And
Yes.
I
I know
talked to
them
both
well.
of them. And there were so many others, but it was just like
Yeah.
who I can contact
Yes.
right now.
Yeah.
And I was like, what should I do? Because even though I had been wanting this the whole time, when the opportunity finally afforded itself, I was
Wild.
like, I don't know. I'm due to
Yeah.
go into the hospital in like 7 hours. And they both gave me their own pep talk in their own way. And they were
Aw.
like, you had always wanted to try. So why don't you just try? And if by the morning it's not happening, you have your answer. But at least give yourself a chance to try.
Mm-hmm.
And I was like, you're right. This is what I wanted. This is
Mm.
like, there's no harm in trying. So I called my OB-GYN back again. I was like, I'm going to go in. I want to try this. And she was like, okay, I'll meet you at the hospital. Let's see what we can do.
Yeah.
So,
Yeah.
and again, I'm privileged. I work at this hospital, called the on-call physician who's also a friend of mine. I was like, I'm coming in and I want to start the Pitocin immediately. Like no messing around. Let's
Yeah.
see if this is going to work. Let's see if
Yeah.
this is going to work or not,
Yeah.
you
Let's
know?
go.
Yeah.
Yeah.
And I'm not afraid of Pitocin. I know it's safe
Yeah.
to use. I knew it's the only thing I had at that point to use.
Mm-hmm.
So it's like, let's start. So
Mhm.
I get in and I have like an incredible nursing team.
Yeah.
One of my favorite nurses whose birthday happened to be on 10/10 and was really motivated to make this happen. We got the IV in, and every 15, 20 minutes, she is going up on the Pitocin.
It's like, "Let's go."
Yeah.
Yeah.
And I was like, please. And by the way, I respect people's decision who don't want to
Yes.
use it, but this was like, this is what I have. Let's go.
Yeah. Yeah.
So at the beginning, I was walking the halls, chit-chatting with everyone,
I
taking
love
some
this.
photos.
Yeah.
And then all of the sudden, shit got real. I was like,
Oh, yeah.
my gosh.
Yeah.
So
Shit
to
got
be
real.
fair, I was on like 10 to 12 units of
Yeah, no,
Pitocin.
you were there. Yeah.
And all of a sudden I was like, holy moly, this
Yeah.
is intense.
Yeah.
So I went
This
back
is
into the
labor.
room. Yeah, this is
Yeah.
labor. I went into the
Yeah.
room, and I had always told myself, I was like, I really think, having delivered thousands of babies and seeing so many people through labor, I was
Yeah.
like, I can like channel it. I'm going to wait to
Yes.
get my epidural. Not that it matters, but I'm going to wait to
Yeah.
get my epidural.
Yeah.
I wanted to try all the medication. So I got a
Mhm.
dose of fentanyl and was like,
Yeah.
okay, like I think I think I can manage. And
Yeah.
then the next contraction came and I was like, can I have another dose? And they're like, not for another 40 minutes.
What do you mean another 40 minutes?
Yeah. And I'm sitting there, like, the bed is up, I'm rocking, and I'm
Yeah,
like,
yeah,
I am
yeah.
strong, I
Yeah.
am resilient, like,
Eh,
the deep guttural noises. That
uh-huh,
shit
uh-huh.
did not do anything for me.
I love it. I love it, but you had to try it. But you had to try it.
Yeah, but I was like, these are so intense. I don't know. I can't I don't know that I'm gonna be able to, like, I need help with pain.
Mhm, mhm.
I also thought, surely if I'm feeling this way, things are changing quickly.
Yeah.
You know,
Yeah.
I was like, surely I'm around 3 to 4 centimeters.
Yeah. Yeah.
Surely this is going to, like, by the time I get my epidural, it will have been the right time for me.
Yeah. Yes.
And so I got an amazing epidural. Like,
Love that for you.
the anesthesiologist was like fantastic, just like so immediate relief.
Yeah.
And I get checked and I'm prepped to hear the news that I'm 3 to 4 centimeters.
Yes. Yes.
I am 1 centimeter. Do you know what,
Okay.
though? Another humbling moment,
Mm.
another point that changed my trajectory of how I counsel my patients. And I
Yeah.
tell my
Yeah.
patients all the time now. I always tell patients, get the epidural when it's right for you. There's no
Yes.
magic number of cervical
Agreed.
dilation, right? But, like, if people were 1 centimeter getting their epidural, I was like, hey, like, did you need it?
Yeah.
And I regret thinking that way.
Oh,
I really
yeah.
do.
Yeah,
Because
because you
here
were in it.
I was that bitch who was
Yeah.
1 centimeter.
But you needed it. But you needed it.
And it was
What
mhm.
was your reaction when they told you were one? Were you just like,
I
"What the
laughed.
fuck?"
I was
You
like,
like,
yeah, I laughed because I was like, I am humbled. I
yes.
am humbled. And to any patient, if I have ever said no, I regret it. I don't think I have. I don't
Mhm.
think I have. But you
Yeah.
know what? I did call and apologize to my sister because she showed up to the hospital. It happened to be when I was on call. So we had to make arrangements for one of my colleagues to come and help take care of her.
Uh,
But she was ruptured and she was on Pitocin. And I remember she was like, should I get the epidural now? And I was like, she was 3 to 4 centimeters. I was like,
yeah.
try and move if you can. Cause, like,
Yeah.
you like to be mobile. It's really, see if you can
Yeah.
move and wait
Yeah.
a little bit. And then
Yeah.
as soon as she got the epidural, she's like, why'd you make me wait?
Yeah.
And I thought, I don't I don't know. I just thought maybe you'd want to move a little bit more.
Yeah.
And before you got that epidural, she's like, no, this is how I wanted to feel like a few hours ago.
That's so valid. That's so
I was like,
valid.
I'm sorry. I'm sorry I didn't realize. So I
Yeah.
called her on FaceTime to tell her. I was like, I just want to apologize because I'm 1 centimeter sitting here with an epidural and I made you wait.
Oh, the humility. Oh, I'm sure she ate up that call. I'm sure she loved that call. Slash, she was
She
just so
did.
happy for you that you were in labor, but
Yes,
still.
she did.
Yeah.
So then I got the epidural. We're still going up on the pit. And then somehow I started shaking.
Mhm.
And in that time, I ended up having like a 12-minute deceleration. The baby's heart rate,
Oh.
his heart rate was in the maybe 70s to 80s
Oof.
for 12 minutes or
Yeah,
so. And the on-call physician came in and she was wonderful again. And she had just started at the hospital too.
aw,
So I
yeah,
had helped recruit her and I think she's
yeah,
amazing, but we hadn't
yeah,
really had a chance to like work together. So
yeah,
hats off to her because it's really hard when your colleague is sitting there with the heart rate down. And
yeah.
I think it's hard when you are working with someone that you know knows things,
Mhm.
right? And I have to
Yep.
remind myself when I'm taking care of other physicians to be like, I'm going to treat you like a patient
Yeah,
and not
yeah,
like someone who can help make decisions. Not
yeah,
who can't help make decisions with me, but
yeah, take a little bit of the pressure off.
yeah,
Yeah,
yeah.
yeah, I
Um,
respect that.
And so we ended up like doing a lot of different positions and I was out of it. I thought it was like 5 to 7 minutes, so I was not worried at all.
Turns out it
And
was 12
so
minutes.
even still, and I'm so glad I didn't realize the time. I do remember distinctly everyone was in my room because
Mm.
when there's a
Yeah,
decel that long, the
yeah,
charge nurse, the C-section charge, the
yeah,
scrub, the we have someone called a drip, which is like another assist to the nurse, the bedside
yeah.
nurse. And I remember just feeling so calm and
Mm.
reassured. I remembered the faces and I was like, I'm in good hands.
Oh,
No
that's so
matter what
beautiful.
happens, I'm in good hands. And
Yeah,
um because I've worked with this team before and I know
yeah.
how good they are. Um and I also remember we had had curry that night and
Okay.
I also panic ate on our way to the hospital because I didn't know. I was like, I'm gonna get an epidural. I don't know what I'm gonna eat. So I ate
Yeah.
frosted mini wheats. And I was hyper focused on what a bad combination that was.
Oh my
So I
god.
remember like making a lot of comments about it, like, I really shouldn't have eaten that. And they're like, can you keep moving, please? The baby's heart rate is.
Yeah, yeah.
I don't know. It's just,
That
I'm
curry
really,
though, and that's frosted mini wheats. But what do y'all think? They're like, the decel, it's still happening. It's like it's basically a terminal bradycardia. Like, come on.
yeah.
Oh my god, that's
I
amazing,
got
Naz.
terbutaline and
Yeah,
we were going to go back to the operating room. And his heart rate just came back up all of a sudden.
Ellis was fine. He was
Yeah.
good and fine. Yeah, yeah.
And again, I had this feeling this is not like me at all. And I'm
Mhm.
really surprised and I'm hoping I can harness this in other parts of my life. But I was so I went in with zero expectations.
Mm.
Like that is not me. I went
Yeah,
in being like, whatever happens, happens. I'm gonna be
yeah,
okay with the outcome.
yeah.
Um, and and I was just so happy to be able to experience labor. Like I
Mm.
really wanted to know what it felt like. I wanted to
Mhm.
know what it felt like to have a contraction. I wanted to know what it felt like for the water to break. I wanted to see would I be able to dilate. So I think if I remember correctly, like when they checked me with the decel, I was about 3 to 4 centimeters.
Mhm.
And then quickly after that, I went to 7. So I
Yeah,
was going through a lot of transition, but
yeah.
I remember thinking through the decel, if I need a C-section, that's fine. I got up to this point and I'm just
Mhm.
so grateful to have gotten to that point.
Yeah.
And I think part of me is also the OB in me understands after doing this for so many deliveries that you don't know until you start the process. So this notion of even being able to get to 10 centimeters to push, like, that's amazing. If we
It's
can get
amazing.
people to that point, that's
Yeah.
great. So really internalizing that for myself and saying, I'm just happy I got to this point. He settled down. They stopped my Pitocin. I think I went until until the morning without any Pitocin, but I was making some progress.
Mhm.
My OB came and checked me. My wonderful colleague who was acting as my doula, she came. I mean, and again, like people woke up at 4 or 5 in the morning to be by my side. That
Aw,
just
yeah.
knowing that they had full clinics the next day.
Yeah.
They came in uh, to check on me. There was a concern at some point that I might need a C-section around 7 to 8 centimeters because I was having a little bit more bleeding than expected. So we didn't know if I
Mm.
was abrupting. And I
Mhm.
remember being like, okay, if that's what I need, that's what I need.
Yeah.
But my OB said, let's give it another few hours. Like, let's continue to evaluate. Let's
Mhm.
check back in 2 hours. And then she checked and I was 9 centimeters all of a sudden,
Yeah.
and the time for my C-section rolled around, and I
Yeah.
was making progress. So I knew, let's keep going. And I won't
Yeah.
ever forget Eva, my
Yeah.
OB, she had to leave for clinic because she had only taken off the morning for the C-section, not the whole day.
Yeah.
She said, I think you can do it, Naz.
Mm.
And she's
I
like,
love
he's a
it.
big baby. He's a big baby. It's gonna take you a while to push, but I think you can do it. And so
Yeah.
just feeling that confidence that
Yeah.
I could at least try. And then the day team came, they were wonderful. I pushed for 3.5 hours
That's not
almost.
bad.
And I'm, girl, that was, yeah, it's not, but it's long
No,
again.
it's long, but not well, I'm thinking about I just again, I've seen Atlas now, and so I'm thinking about
I'm
the
like,
size he was. I'm like, "Hey, you got him out in 3.5 hours? It wasn't 5?" Like, that was me
yeah,
just remarking on how impressive it is, but it is but 3.5 hours of, like, the hardest and again, you lived it, I
yeah,
have not birthed yet, but the hardest work you've ever would do, like,
it
just
is hard.
physically exhausting.
And I want to give a massive, massive shout out to my team. I had an amazing bedside nurse. I had an amazing, like, I had nurses rotating through. We had one of the nurses who's like an expert in purposeful positioning or spinning babies
Yeah, yeah.
coming in and spinning me every 20 minutes. I was doing positions that I didn't know I was capable of doing.
You're like, "My
We
legs
were
can go
used,
there?"
I know,
Yeah.
that peanut ball was being
Yeah.
used in so many
Yeah.
different positions. Like everyone was working so hard to help
Yeah.
me. And I just remember feeling like, wow, this is incredible.
Yeah.
The coaching through the pushing. And at some point I was like, I am gonna need, like, I don't know that this is gonna happen on its own.
Yeah.
Can I get assistance?
Yes.
And with either like forceps or a vacuum,
Vacuum, yeah.
knowing that I wanted my colleagues to be comfortable offering that to me.
Yes.
Because when you have a big baby and it's not moving, you
Mhm.
wonder, is it not moving because it's so big and the shoulder's going to get
Yeah.
stuck? And are you going to pull a baby into a shoulder dystocia?
Yeah.
So my colleague came to evaluate me, and I was like, be honest with me. I'll accept whatever you say. If you
Yeah.
feel comfortable offering me assistance, I'm happy to try. And he was like, yeah, I think we can do it. And let's not try and be heroic about it.
Yeah.
If he's coming, he's coming. If not, we'll do a C-section. I was like,
Yeah.
okay, I'm okay with that. So, what it's like when you call for that assistance, all of a sudden
Mhm.
everyone's back in the room, the
Mhm.
NICU's there, and you're like, shit's getting real. Like, this is it. I have to
Yeah.
push well
Yeah.
for the next however long it takes because this is where it counts even more.
Yeah. Pressure's on.
And in my mind, I had always like wanted the perfect playlist. I wanted like the song that he was born to. The music was long gone. I didn't have time to touch up my lipstick. I
Yeah,
was just
yeah.
so ready to meet him.
Yeah.
By the way, a little aside, my mom
Please.
was in Iran at the time. And so my dad was here, and I know he
Aw.
was feeling anxious.
Yeah.
And they told me, like, your dad is here and is asking for you. He wants to come in the room. And I knew that he was getting more and more anxious being out in the lobby than in the
Aw.
room. So I was like, you can
Yeah.
come in, but you have to stand behind the curtain.
Yeah, yeah.
And so he came behind the curtain and he was offering me encouragement from behind the curtain.
Oh, sweet
He was,
dad.
but then immigrant, lovely father that he is,
Yeah.
towards, hour 3 was like, come on, Nazaneen, the room next door delivered. Come on, you can do it.
He's like, pressure is on. Like, seriously, girl? Oh yeah, it sounds like something that would
Like,
come from my parents. I love our
yeah,
immigrant parents. So honest, so
yes,
honest.
I know. It's like, Dad. So for the actual delivery, I asked him to
Yeah,
step out because I was like,
yeah,
this is going to overwhelm him.
yeah, yeah. So many people in there.
But it was a beautiful, what appeared by my colleague, I don't know how he felt doing it, effortless vacuum. He was, I
Yeah,
think, delivered over 2, I forget now, like 2 contractions or so, and he was
yeah.
born, and it was a very different experience from the girls.
Mm-hmm.
For him, for this for this one, I cried. I was just
Yeah.
I started crying, and I remember thinking, "I've been waiting so long to meet you.
Oh, sweet baby
I'm
boy.
so happy you're here." And
Yeah,
again, I recognize that some people wait so long, and longer
yeah.
than I did. But there's a 7-year age gap between our children. And I remember feeling a little bit of a loss that it was going to be 7 years.
Mm,
And I had this moment where I delivered a third baby for a couple that had a same age gap. And I
yeah,
remember seeing how joyful they were
yeah,
and reminding that it doesn't matter that it
yeah.
didn't fit my timeline. They're so happy. And whatever it is, this baby is being born into a family that's so excited to meet him.
Mm-hmm.
And he has 2 adoring sisters who can be helpful. So I
Yeah,
was just so happy.
yeah. Tears of pure joy. I'm feeling it. You're trying to make me tear up right now. They're tears of pure joy, and every time. And thank you. I mean, you're such a eloquent and exciting storyteller. So thank you for reliving it all. But there's so many times where I recognize for us as OBs, we have the honor of being at these like life changing moments. Like you were in it, right, when
Yeah.
Atlas came, but recognizing that like that your life felt that much more full. This was a long anticipated, long awaited
Yeah.
arrival for your family. And even having that turn of events of expecting you were like hours away prepping for your scheduled C-section, getting those press on nails on,
Yes.
you
I
know?
know.
And then suddenly like what is this drippity drip drip, right? And so that like that complete pivot, but also being able to honor yourself and
Yeah.
having the experience of trying to labor, right? Like what I really appreciated about your story, besides just the twists and turns that made it so exciting, was just your level of acceptance, right? This like place of
Yeah.
peace that you're just like, you know what? I got to experience labor. I got to experience my water breaking. I got to experience contractions. I dabbled in some different forms of analgesia, but whatever the outcome, even if I end up with a C-section, I'm at peace. This
Yeah.
is hard. And I understand that so much of your story was because you legitimately had kind of accepted this scheduled C-section. So everything was like an added bonus. But as
Yeah.
an OB and as someone who is so deeply introspective and reflective as I am, when you take your experience in that precious place of peace that you were in of accepting the outcome no matter what, like how do you give that back to your patients? Like how do you support the patients who are coming in with that birth preference plan that is 10
Hmm.
pages long and you kind of
Hmm.
reframe it from a plan to your wish list, to your
Yeah.
preferences, right? And knowing that there's only so much locus of control that we have in our birth experiences.
I think I'll start with first acknowledging that I was really lucky to feel so trusting of my team. I
True.
knew everyone who was taking care of me. I didn't doubt 1 second that they weren't going to take care of me well.
Yeah.
In fact, I was even more amazed by how well taken, how well taken care of I was.
Yeah.
And I don't think a lot of patients get to come in fully appreciating that. How
Mhm.
could you? You've never been in this environment. It's
Mhm.
your first time. Maybe you're a woman of color or you're a Black woman and you hear all the time how outcomes are worse and you are
Yeah.
on the defense
Yeah,
starting from the
rightfully so.
beginning, right?
Yeah.
And yet I'm coming into this having nothing but trust.
That's
So
privilege. Yeah.
that is, and I think
Yeah.
think that is a big thing in what helped me feel okay with whatever happened. And so I do think it's nice when we do have an opportunity to have a relationship with patients and have this discussion ahead of time. I can't control the patient who comes in who I've never seen who wants a VBAC. I can
Mhm,
try and make them feel comfortable in that time I have with them. But at least when I
mhm,
have my own patients who are going to try and VBAC, starting that conversation early,
mm.
talking about flexibility, saying that we want this to be a good experience for you. I think, I don't always love anecdotal evidence because there's a story for every different
Yeah,
outcome, but
of course, of
I
course.
do share my own I do share my own experience because I hope it relates to someone. I get it.
Mhm.
I also wanted this thing and I was able to get it.
Yeah.
But I think really focusing, I do rename it. I say, like, let's talk about it. It's not a plan, these are preferences.
Mhm,
And if there's anything I've learned through this process, as much as I want you to try and envision and have a hope for what you want to happen, being flexible is one of the keys.
mhm.
And then if I'm in a situation where there's a patient I'm meeting for the first time who I can tell wants something to go one way
Yeah,
really strongly and deeply, and I get why they're trying to advocate for themselves, but
yeah.
it's starting to feel like they're getting in the way of themselves.
Yeah, we've seen that.
And not to say that I know why I understand. Well, sometimes I don't. And it's helpful for me to sit and be like, and to understand, like, tell me a little bit more. Why are
Yeah,
you scared of Pitocin? What
yeah.
were you hoping for? What did you think? And I do learn a lot. Oh, maybe there's a misconception that I can help
Mhm,
allay.
mhm.
But sometimes I'll have, and this is after sitting with them a few times, a frank conversation and say, I'm worried that these interventions, or I'm worried that what you're asking for is taking us away from that opportunity to really give you your best chance at a vaginal delivery.
Yeah, yeah,
And I know you don't know me. I know we don't have a relationship,
yeah.
but I want to convey to you that I am invested and I want this for you, but we have to try some other things to try and get there.
Mhm.
I did this more in San Francisco than I did here because, quite frankly, in my health and in my environment, we don't have as many doulas, but sometimes I would take the doula out of the room and ask to speak to them and say,
Yeah,
like, what can we do to make sure that we're on the same page?
yeah, yeah. I like that. Yeah. No, I love it. I mean, I think that you and I are doing a lot of the same things already. Maybe because we trained the same place or we're just similar people, but it's really about expectation setting. And to me, just creating space, asking questions of curiosity, right? Like there's so
Right.
many, everyone is so anti-Pitocin. And I get it. There's a lot out there that's anti-Pitocin. Some of the concerns are valid, but a lot of them are opportunities for re-education and clarifying
Yeah,
misconceptions. I love a good conversation, right? And so I think all of us providers have the opportunity to like walk into any interaction just with curiosity, just like open
absolutely.
humility and curiosity, because it's scary. Like as we alluded to um, at the beginning of our conversation, like for a lot of our patients, like that's their very first time walking into this like big old building that is a hospital,
Right.
and in their minds it could be associated with so many different negative connotations, right? So
Absolutely.
we have so much privilege, and I love both of your stories because goodness, you Nazanin are just so fortunate, and I know you reflect on that,
Yeah.
right? This the C-section of the twins with your dream team, and then
Yeah.
your successful VBAC with like a whole cadre of nurses and anesthesiologists
Physicians
and
and
physicians and
yeah,
everyone in between who already knew
are
you and loved you and were so invested in you and Steven's family. So yeah,
truly.
I love your stories.
Thank you. I really feel grateful. And I think what a testament to be able to deliver in the facilities that I work and be proud of the care that I received. Right? To
Mhm.
be like, I would do it
Yes.
all over again in this place
Yeah.
with these people. I'm so
Right?
glad that I'm working here.
Yeah.
And so I think for me too, it gave me a whole other, sense of appreciation. I'm not in the room with the patient for 8 hours or however many hours, helping them with their Pitocin, helping them with their position changes, with their pushing. And so I've always been grateful for our colleagues in nursing, but just
Yeah.
another layer. So
Of gratitude.
yeah,
Yeah. 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 No, I mean,
absolutely.
and I think that's why, we started our conversation with you asking, like, why did you want to be an OB? But I think one of the reasons why I personally chose to be an OB is because I always grew up playing sports. I love the idea of a team mentality, and especially in
Yeah,
obstetrics, as well as gynecology, like in the OR and so many other things that we do, but especially obstetrics, it is a team. There is so many people invested in your outcome. There are so many people every time a patient comes to the hospital who are invested in
absolutely.
their outcome. And I think it's like a nice reminder that even though we're all strangers, we're all strangers who are really, really care for the best for you and your baby, and who are invested
Yeah.
in a healthy, safe outcome. And everything that we can do to create that sense of stability and safety is our privilege, and is it's honest to do. And I think so many of us don't take that for granted.
Absolutely. No,
Yeah.
and we have a ways to go. I know there are reasons why people are, mistrustful, and
Mm-hmm.
I know that unfortunately people continue to have poor experiences, but I think the
Yeah.
majority of people, uh, I want to believe, and I do believe the majority of people are trying to do their best, are
Yeah.
trying to show up and take good care of you. And I hope, like, I encourage patients, talk to your provider. Also, as much as the provider should be curious, you should be curious as well. Ask your
Yeah.
provider, rely on your provider. It's
Yeah.
great that we have people on social media, but understand that, try and understand who you're getting your information from. And if
Mm-hmm.
you want some
Mm-hmm.
people on social media that are really that you can trust the information they give you, ask your OB-GYN. And if they don't know, ask them if they have if they know where you can go for that additional
Yeah.
information, because misinformation is really hard. But
Yeah.
it is, I also think one thing, and this is another thing that I think of, we're really focused on healthy baby, healthy mom, or whoever's
Mm-hmm.
birthing
Yeah.
the baby. And that can be true, but someone's experience can be wildly different from
Yes.
that,
Yes.
right?
a
And
hundred
so I
percent.
also try and remind patients, like, our outcome does not necessarily reflect the experience that you have.
Yeah.
And yet, that experience is but a point in time
Mm-hmm.
of all of this, right?
Yeah.
Labor is maybe 4 days if you have a long
Yeah.
induction,
Yeah. Yeah.
in the scheme of a lifetime.
Yeah.
Or,
It's a
like
blip.
postpartum being a year, it's a blip.
Yeah.
And
Yeah.
yet, when you talk to patients, you recognize what a powerful and emotionally charged few days that can be,
Yeah.
such to the point that some people will come out of it experiencing trauma.
Yeah.
Others will come out of it maybe not fully understanding what happened, but happy with the outcome,
Yeah.
wondering if they could have achieved some of their preferences and weren't allowed to.
Mm-hmm.
Others, like me, will be completely thrilled.
Yeah.
But it's like the spectrum is so wide
Yeah.
for
Yeah.
that
It
one
really is.
outcome of healthy baby, healthy
A healthy
mom.
mom. No, I'm so glad that you spoke truth to this. I mean, I just actually recorded another podcast earlier today about perinatal birth trauma and how incredibly common it is, right? One out of
Yeah,
three birthers will experience it. And so just recognizing that we often do to say, like, well, guess what, guys, both the patients came out the other side, like, we're so
yeah,
happy. But something about that experience for you, for the third person trauma, so for the support person in that room, your poor dad behind
absolutely.
the curtain, like, something about that could have still affected someone either directly or tangentially. And we'd be amiss if we didn't recognize that. But that being said, so much of the conversation that we've had, why I just stated it and therefore birthed the podcast, because I still haven't birthed really human babies, but this podcast is my baby, is because I really do want to be a part of the thoughtful, well-informed discussions out there. I'm not viral, I'm not hot on TikTok, I'm nothing, but I think that voices like ours, conversations like this, hopefully will still make its way out there just so it can help empower patients to figure out, the right questions to ask, help people feel encouraged by both of your amazing stories, but also reflective and not alone in that deep transition of matrescence,
Yeah,
of postpartum depression, anxiety, that sense of isolation and like, is it just me? I'm My
right,
primary goal of this is create a sense of community where, like, no, it's not just you and
right.
it's real and let's talk about it.
Yeah,
So I'm grateful because we
absolutely.
went through the whole gamut, girl.
We
We
did
covered
a
it
lot.
all.
We did a lot.
Oh my God. And we're like, we're and I know that your daughters are like back from camp and a sweet little Atlas is off somewhere. I know that you are needed and wanted. I mentioned your kids, but you also have a job and you have several other jobs. So anyway, I just want to recognize you were so generous with your time.
Oh,
I am
this
so
is such a
grateful.
joy.
I am so grateful that whatever fate allowed, your sub-I and my like third year
I
med student
know.
rotation like overlapped perfectly, and it led to a friendship that's existed
Yes,
years then out. And I'm not saying this to just like chum you up, but you truly have always been a inspiration for me. The way that you are giving back to our community and the patients we have the honor to serve in so many different important ways. So you being a
thank you.
voice on this podcast means so much to me. So thanks for
That means
joining in
so
on the
much to
fun.
me. I mean, this was such a joy and pleasure to record. I feel like we haven't had a chance to catch up in so long, but this you got to hear a lot about me, so we have to schedule something off podcast
We
hours
will.
so I can hear about you and
We
all the
will. We
exciting
definitely
things you're
will.
doing. I get updates from some of our mutual friends, but
Yes. Yes.
I hope that you continue this because you've touched on so many great topics. I was just listening
Mm,
to your podcast with Dr. Yang, and I think there's so many. Yeah, it's so complex. There's so many topics to cover
yeah.
in this time period, and I feel grateful that I could come and share my story with your
Yeah, it's
audience.
and they're great stories. And yeah, the goal is to like to not stop. There's so many things that we can talk about. I think this is such a rich and dynamic, transformative period from preconception and beyond. And so yeah, I
Yeah,
hope we continue to have conversations like this on and offline.
absolutely,
So thank you again, Dr.
absolutely.
Naz. I really, really appreciate
Awesome.
you and your
So
beautiful
good to see
family.
you. Thank you.
Thank you very much for listening to The Golden Hour, the podcast community where moms and moms to be can hear stories from other mothers and learn from top experts in pregnancy and postpartum care. If you enjoyed this episode, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, questions, or suggestions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Looking forward to seeing you in the next episode. Until then, stay golden.